Good morning and thank you for coming. My name is Jonathan Modi. I'm Lead Communications Officer for the Oregon Health Authority Public Health Division. This is a press conference to provide you an update on Oregon's response to the outbreak of novel coronavirus, COVID-19. We will start with remarks by Governor Kate Brown, Oregon Health Authority Director Patrick Allen, and Dr. Dana Harganani, OHA Chief Medical Officer. We also have other OHA representatives on hand, including Dr. Paul Cieslak, Medical Director for Communicable Diseases and Immunizations, and current Senior Health Advisor on OHA's COVID-19 response. We have Dr. John Fontana, Director of the Oregon State Public Health Laboratory. In addition, we have senior representatives of the 3 counties that are reporting new cases today, including Dr. Bob Dannenhofer, Administrator and Health Officer, Douglas County Public Health, Dr. Christina Baumann, Deputy Health Officer, Washington County Public Health, and Katrina Rothenberger, Director of Marion County Public Health Division. After remarks are complete, we will open it up to questions. Those reporters watching the live stream can send follow-up questions after the press conference to phd.communications@state.or.us. Also, those watching the live stream may not be able to hear the questions being asked, so I would just ask our speakers to try to repeat the questions before responding. With that, I will turn it over to Governor Kate Brown.
Thank you and good morning. I appreciate you all being here this early on a Sunday morning. 9 days ago, I announced we had Oregon's first case of COVID-19 coronavirus. Late yesterday evening, we learned of 7 new cases in Oregon, bringing the total number of cases in our state to 14. First, my thoughts and prayers are with these Oregonians and their families. I understand that this news is very concerning. As your governor, I want to reiterate how seriously we are taking this situation. I have consulted with the Oregon Health Authority, and I am declaring a state of emergency to ensure that we are able to swiftly deploy the personnel and resources necessary to address coronavirus in Oregon. This emergency declaration gives the Oregon Health Authority and the Office of Emergency Management all the resources at our state's disposal to stem the spread of this disease. Specifically, it activates Oregon's reserves of emergency volunteer healthcare professionals. This is particularly important because of the cases identified in rural Oregon. It unlocks valuable support to help local public health authorities. Additionally, the declaration grants broad authority to the State Public Health Director, to OHA, and to the Office of Emergency Management to take immediate action and devote all available state resources toward containing this disease. When the first case hit in Oregon, our teams were ready to quickly identify and monitor those impacted. We also investigated others that may have come into contact with the individual. It is through these preparedness and response efforts that health officials are identifying and monitoring new cases. The situation is evolving here in Oregon and of course across the entire globe. I understand that it can be scary to hear news of fellow Oregonians coming down with the coronavirus. I have directed the Oregon Health Authority to consistently disclose information on positive cases moving forward, including age ranges statewide, and cases by county where individuals with the coronaviruses are located. I can also assure you that local and state health officials are working around the clock to address this crisis. They are trained professionals who are putting your health and safety first. Additionally, I am in constant contact with our congressional delegation and others at the federal level to ensure Oregon is receiving the attention and resources we need from them on this issue. We will do everything in our power to keep Oregonians safe. This state of emergency will remain in effect for 60 days. It can be extended until the public health threat of the virus is contained. With that, I will invite OHA Director Pat Allen to give more specifics about the new cases and to share next steps in our response efforts. Thank you very much. Pat?
Thank you, Governor. Today, what I'd like to do is give you a brief summary of the latest information we know about COVID-19 and tell you how we intend to use the powers under Governor Brown's emergency order to mobilize Oregonians in an unprecedented state and private effort to contain the spread of COVID-19 in Oregon by focusing on specific at-risk populations, protect Oregonians at greatest risk of the most severe outcomes of this disease, older adults, people with underlying conditions, and the homeless and people who are vulnerable in other ways, and respond with fast, targeted, and effective measures to safeguard our state against widespread illness and disruption in the face of a growing outbreak. Yesterday, the Federal Centers for Disease Control and Prevention issued guidance that identified older adults and those with underlying health conditions as being the population at greatest risk. Our strategy is based on the emerging science and the risks identified by our federal partners. As I've been saying throughout, the time to declare an emergency is when we need the tools that an emergency declaration provides to protect Oregonians most at risk. As Governor Brown told you, the COVID-19 outbreak continues to expand in Oregon. Many Oregonians are wondering, will COVID-19 appear in my community? Will it affect my family, friends, and other people I care about? Could I get COVID-19? I understand these worries. Oregon public health experts and healthcare providers are learning more about COVID-19 every day. We're working closely with healthcare providers and local public health officials to test and treat patients, identify people at risk, and keep you informed so you can protect yourself and your loved ones, and help us stem the spread of COVID-19 in our state. What we know: the Oregon Health Authority has confirmed 7 new presumptive cases of novel coronavirus, resulting in the disease COVID-19, bringing the state's total number of those who've tested positive to the virus to 14. The 7 new cases are located 1 in Douglas County, 1 in Marion County, and 5 in Washington County. The cases include a mix of community spread and spread related to contact with a previous case. There are no travel cases in these 7 cases. Contact investigations have begun to identify and isolate anyone who may have been in close contact with these new cases. Today's news is both troubling and expected. We know COVID-19 is in the United States and in Oregon. COVID-19 is a communicable disease. We know it will spread. We know we will see more cases. But we also know there are steps we can take to prevent COVID-19 transmission and protect people most at risk: older adults, people with underlying medical conditions, people who are homeless or face other barriers to medical care and services. All of us have a role to play at work, at home, and out in the community. By taking effective evidence-based action, we can slow the spread of COVID-19, protect people who are most vulnerable, and deny the virus the opportunity to cause widespread disruption to our daily lives. The Oregon Health Authority continues to take action to fight the spread of COVID-19 in the state. The emergency powers Governor Brown has authorized today will give us more freedom and flexibility to contain the outbreak and protect Oregonians. Here are some specific actions we're taking. We're expanding testing. OHA is finalizing agreements with major hospital systems to expand COVID-19 testing and expand locations where COVID-19 tests can be conducted safely without creating avoidable exposure risks for other patients and the healthcare community. We are prepared to activate volunteers who are trained and licensed medical professionals who can augment services available in local areas, particularly rural communities whose public health resources are stretched thin. We're expanding telemedicine. I'm using my emergency authority to give health systems, insurers, and coordinated care organizations greater flexibility to expand telemedicine in Oregon. Telemedicine is an effective way for healthcare providers to screen, evaluate, and treat patients who may be worried but well, mildly ill or at risk, without coming into a clinic or hospital emergency department and exposing other patients and healthcare workers to potential illness. I'm convening providers who serve older adults and other vulnerable populations to mobilize an aggressive outreach and prevention strategy to protect the people who are most at risk. And finally, more funding. Tomorrow, the legislature will consider an emergency $5 million request for funds to fight COVID-19 in Oregon. We will continue to assess our need for resources to support Oregon's strategy to contain, protect, and respond to the needs of Oregonians who face the greatest risk from COVID-19. Finally, let me say this. In Oregon, we have many strengths and tools to be able to fight the spread of COVID-19. A passionate and well-coordinated public health system, effective and aligned healthcare providers, higher rates of healthcare coverage than most other states, which give 94% of Oregonians the ability to access medical care, paid sick leave laws that give people in Oregon the ability to stay home if they're ill and protect coworkers and others in the community. However, we cannot combat COVID-19 if we turn on each other. COVID-19 does not discriminate. That only puts sick people and the broader community at risk because it discourages people from seeking the help they need, from getting tested, from getting care, and staying at home. We cannot shun and stigmatize people who test positive or become ill. We must join together to take science-based actions that protects those who are most at risk and minimizes unneeded, counterproductive disruption in our community. Now I'd like to turn the podium over to Dr. Dana Harganani, Chief Medical Officer for the Oregon Health Authority. Dana.
Thank you, Director Allen. I'm Dana Harganani, Dr. Dana Harganani, Chief Medical Officer at the Oregon Health Authority. I'm also a practicing pediatrician and a mother of 3. I know people across Oregon are concerned about COVID-19. Today, I want to tell you the latest information we know about the cases Director Allen has mentioned. So what do we know? Yesterday, the Oregon State Public Health Laboratory identified 7 new presumptive positive cases. That brings the total positive cases of COVID-19 to 14 in Oregon. The location of those include 1 case in Douglas County, 1 in Marion County, and 5 are from Washington County. 3 of the cases were hospitalized at the time of diagnosis, and the remaining 4 cases experienced mild illnesses and symptoms and are recovering at home at this time. None of the new 7 cases are related to international travel. 4 of the 5 new cases in Washington County are related to contacts of previous identified cases. The remaining 3 cases are being considered community acquired. So what do we know about the risks of COVID-19 for Oregonians? What we do know is that most people who get COVID-19 are going to experience mild symptoms. We know from data collected nationally and internationally that most people who contact COVID-19 experience symptoms similar to the common cold, a cough, a runny nose. This week, the Center for Disease Control identified a set of population who are going to be more at risk. Those include older adults, people who have severe and chronic medical conditions like heart, lung, or kidney disease. We also see from the earliest data that those older people are twice as likely to have more severe disease than others. So how can older adults and people with underlying chronic medical conditions stay safe and healthy? First, the recommendations are to minimize contact with people who may be ill and try to avoid large public gatherings. Ensure that you have prescriptions at home to last you for a while. Consider mail order. Also, just continue to take common daily precautions. Wash your hands frequently, don't touch your face and eyes, and clean surfaces. As Dr. Allen mentioned, we're focusing on our testing capability. The Oregon State Public Health Laboratory is beginning to run low on certain components, but we are looking at resupplies from the CDC and working with our state partners to the north. Also, as Director Allen noted, we are working with hospitals to bring more testing capacity online as soon as possible. We know we can all work together to reduce the spread of COVID-19 in Oregon and continue to protect the most at risk. Thank you.
Hello, I'm Dr. Bob Dannenhofer. I'm the Public Health Officer from Douglas County. Douglas County was notified last night that we have a single presumptive case of COVID-19 in Douglas County. I'm pleased to report that the patient is medically stable. Thank you.
Good Good morning. My name is Katrina Rothenberger. I'm the Public Health Division Director for Marion County Health and Human Services. Marion County has one presumptive positive of the novel coronavirus, COVID-19. Our thoughts are with the affected individual and family. The health and well-being of Marion County residents is our #1 priority as we respond to the needs of our community. Public health staff are working through the weekend to identify close contacts to the individual. The Marion County case had no previous contact with other confirmed cases and is suspected of being community acquired. Most people with COVID-19 have mild symptoms. If you are feeling sick with mild symptoms and do not need to seek medical care, stay home while you recover. If you are sick and plan to seek care, please call before going in for care so arrangements can be made to prevent exposing others.
Hello, everyone. My name is Dr. Christina Baumann. I am the health officer for Washington County. As you heard, Washington County has 5 new presumptive cases of COVID-19 illness. 4 individuals were identified through the public health investigation. The 5th does not appear to be related. Washington County continues our work to identify close contacts to these new cases. I want to underline the point made by our colleagues that COVID-19 can present as a mild illness. We want people to take this seriously and take measures to protect those that are most vulnerable. So we ask you, if you have any illness symptoms, please do not visit people in hospitals. Please do not visit your loved ones in long-term care facilities. Protect those who have chronic medical illnesses and who are older. We thank you for participating, helping, caring, and we will continue to work as public health to do what we can, and we ask you to also please do what you can. Thank you.
So, open up the question.
Can you give us the age ranges of the people that were mentioned today?
Yeah, thanks. The question was, can we provide the age ranges? We'll be providing the age ranges as part of the tabular information that we'll release, that we update to the website, which should be shortly if it hasn't already occurred.
Has there been any investigation into where the first case in Washington County contracted COVID-19?
The investigation has not identified any association with travel or any association with any other known cases.
Just to verify, the one of the 5 in Washington County cases, is that something that we just
I can. So we're not at the state level providing specific hospital information. The hospitals themselves are able to report as they'd like. And again, for people who didn't hear the question, was it true that one of the cases is at OHSU?
Another question. If you're saying that this disease is clearly being spread by people who aren't the ones who are being tested, when you say you're expanding testing, who are you expanding testing to, and will you begin testing people who aren't hospitalized or aren't these at-risk populations?
Just to repeat the question is whether we're going to be changing our recommendations for testing, talking about getting more capacity for testing. And the answer is right now we are continuing to recommend testing of the highest risk patients, those who are hospitalized, who have symptoms of lower respiratory tract infections and do not have another reason for that, such as influenza, as well as those who have traveled from high-risk locations and those with known case contacts.
So then how are we going to know how the disease is spreading if most of the people who get it are not hospitalized? It seems like, how are we going to know how it's spreading in the community?
Yeah, well, we definitely know, as stated already today, it's in the community, and many people are going to have respiratory symptoms that are mild. We need to continue to ensure that our testing capacity is focused on those people at greatest risk and to investigate those contacts.
Hi, I'm Dr. Paul Cieslak, Medical Director for Communicable Diseases here at the Oregon Health Authority's Public Health Division. For testing conducted at the Oregon State Public Health Laboratory at public expense, we're trying to focus on answering the questions that we need to answer epidemiologically to help us deal with the overall outbreak. Those questions basically are, what is the extent of the outbreak, how widespread throughout Oregon is this virus, and who is most at risk? So who are the at-risk groups? We have data from what the Chinese have reported, but we're kind of interested in seeing exactly what the virus is doing here in Oregon. So we're going to limit our testing based on those parameters. We want some tests from around the state, and we want some tests from the most severely ill people, and then from close contacts of cases to get a notion of its transmissibility. But I will say that private laboratories are rapidly coming online with their own testing. The University of Washington is testing. LabCorp came on this past week. Quest promises to come on Monday, and we're not offering any restrictions around those. Physicians will be able to conduct that testing on patients that they clinically think ought to have it. We're making the disease reportable. We will get those reports, so we'll be privy to knowing about cases that are diagnosed by private providers, whatever the nature of their illness.
I guess I'll ask another question.
Go for it.
So, in Washington, just today, they're talking about social distancing and other measures. I know we've been told over and over again, stay home if you're sick, wash your hands. Is Oregon going to expand the recommendations for things to do beyond those two things everyone's now hopefully already doing?
The question, again, is whether or not we're going to expand any recommendations on social distancing. At this time, we're still focused on the most vulnerable populations, as we mentioned, in alignment with the CDC guidance. So older populations, those with chronic medical conditions, we're recommending to stay out of large public areas, stay away from people who have symptoms, and to take care at home when you can. At this time, we are not recommending any other changes. We're continuing to monitor the situation as it evolves, and we'll continue to be giving guidance to facilities and schools to give those types of recommendations, but generally no changes at this point.
You guys mentioned that there will be an expansion of telemedicine. What will that look like, and how will that be
Yeah. The question was the comments that were made earlier about expansion of telemedicine and what will that look like. Right now, we know many health systems and providers have capacity for telemedicine. We are just encouraging people who don't need to go into the hospital to be checked or to their provider to call first. We're encouraging providers, health systems to build up their capacity around telemedicine, and we'll be looking to identify what barriers we can help to address where they might be.
Let me add to that. Just to add a little bit, in things like Medicaid, there are billing code issues and requirements on what kind of contact needs to be involved in telemedicine, and throughout the different paying sources, those are the kinds of things that we're looking to be able to take down those kinds of barriers as well.
Can you tell us if the Washington County case was cases that were already known contacts, or with the Kaiser staff, or with the employees in the
So I'm sorry, I can't give you any, to repeat the question, you were wondering about what we can disclose about the connections between the cases in Washington County. So as I mentioned before, there are 4 new cases that were identified through the public health investigation to the first case. The 5th case that we're releasing telling you about today is not associated with those other cases, as we know right now.
Can you tell us in Washington County, I know you told us overall how many cases were hospitalized and how many people are at home. Can you tell us county by county who's hospitalized and who's at home? I know, I guess we heard that Douglas County was recovering, but
Yeah, no, to protect patient privacy and help maintain the effectiveness of public health's ability to work with individuals, we're going to report the hospitalized versus non-hospitalized in the aggregate and not by specific geography. You can imagine as we expect this to move to smaller communities, that becomes a real challenge, particularly in small counties, to try to report that level of detail and not disrupt patient privacy.
right, and will you be releasing any information about where people who have been
Yeah, exactly. We won't, and I might ask Dr. Cieslak to comment on why we do that for measles and why we don't do that for a disease like this, if you would.
Sure. In a disease like measles, there are specific recommendations that we want people to do. And the main one, of course, is to get vaccinated. Also, measles is spread by the airborne route, which means that you can contract it just by being in the same room as a case of measles who's coughing. COVID-19, on the other hand, we think is mostly spread by the droplet route, almost if not exclusively spread by the droplet route, which means you need to be within a few feet of somebody and be coughed on. So close contact, prolonged periods of time, the highest risk people are the household contact. So it's quite unlike measles in terms of its transmissibility.
Yeah, so the question was if we bring licensed and trained volunteers that we're able to call up through this emergency order into rural communities, what would that look like? The answer at this exact moment is not quite sure. There are a number of ways we could deploy those individuals. One example, not that we've made a decision to do this, but local public health can be taxed quite immediately with contact tracing. It's a labor-intensive piece of work. And even larger counties have limited resources to be able to dedicate to that. So that's the kind of work that a properly trained volunteer might be able to take up to allow the county's public health staff to be able to focus on something like services to at-risk populations or providers to them, as an example. Sure. I expect there to be resource stresses around local public health all across the state. In many cases, they could certainly be worse in rural areas, but I think there will be challenges even in our most urban counties. Yeah, I don't have information to share about that. Sure. Yeah, right. Yeah, the question is, what are we doing for homeless or other special populations that have got difficulty accessing care or might have specific risks? We have a work group today around people who are unhoused to work on the set of services and assistance that they need. We're convening a work group around the elderly and congregate care, similarly to look at the specific steps that we can take to provide assistance to the providers of that care. And we're working to roll out recommendations and actions as quickly as we can as we move those. It's really helpful for us to begin with CDC to really dial in on what are the specific risk areas, knowing that that the disease is much more significantly dangerous for the elderly than for kids and young adults, for instance, helps us really focus our resources and our work. Dr. Jennifer Vines.
Hi, good morning, everybody. Dr. Jennifer Vines. I'm the Multnomah County Health Officer, and I've also stood in front of you as the lead health officer for the metro area counties. I will share a bit more detail about what Multnomah County in particular is doing among our people who are unhoused and living in congregate settings. We, for the past several days, have been in touch with homeless service providers around basic infection control precautions, separating sick from well, for example, and answering their questions around disinfection and how to keep people safe. We have more coming, but we are taking this issue very seriously under the direction of the Multnomah County Chair, and we have more plans coming to protect this particularly vulnerable community.